Well, thank you, Mr. Chair, and thank you to all of the witnesses for being here today. As I look at your bios, I'm realizing that the combined years of public service sitting before us is extraordinary, and I thank you all for your service. There will be time for thorough review of everything that went wrong with the administration's response to the current pandemic. Our nation can better prepare for future pandemics by reversing cuts to public health and preparedness funding, re-engaging with international partners, and ensuring that key federal positions are occupied by qualified staff. However, we are in the middle of a pandemic now. COVID-19 continues to spread quickly through the United States, even as many European nations have gotten their outbreaks under control. America has 4% of the world's population, yet 25% of the overall deaths from this pandemic and 20% of new daily cases being reported. In my home state, the toll in our nursing homes continues to be extraordinary. 80% of the deaths in New Hampshire have been in long-term care facilities. Our primary focus must be on strengthening the federal response to the current pandemic that is still raging across our country. So I want to start with a couple of questions to Dr. Khaldun. Dr. Khaldun, in the early stages of the pandemic, Michigan's per capita testing for COVID-19 was below the national average. Since then, you've been able to not only ramp up testing, but become one of the few states to have an infection rate of less than 1% among those being tested. What specific steps were critical to addressing those initial challenges in your state, and what federal support is needed to help other states replicate your approach by expanding testing capacity, improving demographic data collection from testing sites, and using that data to quickly respond to potential outbreaks?
So thank you for that question, Governor. It has certainly been a massive effort and response, not only from our state and local health departments, but our procurement team in the state, our Michigan National Guard. There are many, many people who have contributed to us being able to respond, going from just a few hundred tests a day to now about 14,000 a day. We have focused on absolutely bringing testing into communities, so working with community partners. We've made sure that when we do our contact tracing, we've updated and have to do it again, building the plane while we're flying it, updating our contact tracing platforms so that we can effectively isolate, understand who's potentially been exposed, and then isolate them as quickly as possible. So again, it's been a massive effort, but I would not say that we are necessarily winning in Michigan. We're still seeing outbreaks across the state, and we continue to work hard to expand testing.
Well, that's helpful. Are there particular things you think the federal government can do?
Yeah, again, I've been really pleased that we've been working with our federal partners on testing supplies, but often we don't know when those testing supplies are going to come. And when they come, they're less than what we expected to get, or they're not even useful. So we need really a clear strategy from the federal government on supplies, when we will get them, so that we can actually plan on the state and local level for how we'll get those supplies out.
Well, thank you. I also wanted to follow up with you on another issue. In April, you wrote a letter to clinicians across Michigan highlighting the fact that African-American residents comprise 40% of COVID-19 deaths statewide, despite making up only 14% of the state's population. And this is a disparity that you've talked about a little bit today, and it's a disparity we have seen across the nation during this pandemic and in overall healthcare and outcomes. What types of dedicated investments from Congress are needed to give state and local governments across the country the support they need to improve health and wellness in communities of color and work towards eliminating these health disparities during the pandemic and beyond?
So we really have to focus upstream and talk about those social determinants of health. So housing policy is health policy. We have to make sure communities of color who are disproportionately living in poverty have access to healthy and safe housing. Making sure they have access to health insurance and expanding Medicaid across the country will be important. No one should have to pay out-of-pocket costs for testing or treatment or a vaccine. And we need to make sure there's equitable distribution across these communities to make sure that we're addressing these disparities. In that letter, I also talked about implicit and explicit bias in our healthcare system. Again, many people, it's been well documented that these disparities and these biases exist, and that's partly why I sent the letter as well.
Thank you very much, and thank you, Mr. Chair.